Hello everyone, it is Andrea from Chronic Matters trying to do this video for a third time. And they say third time is a charm, so let's hope I can make it more than 3 minutes into the video. Not that it's a big deal. The first one was cut off because my watch started talking to me, and the second video was cut off because I received a phone call. And if I felt well enough, even though I think I look okay when it's in cinematic mode with like the ring light behind me, if I felt okay, I could sit and, put these videos together. But since I'm super sick and I just can't manage that right now, that we're just doing this in one shot goes so that I can upload it to YouTube, because I really want to build this channel, but we're going back to basics. Otherwise, it's just simply not going to happen. Anyway, hello, welcome. It is Halloween on, October 31st of 2023. I have no idea how quickly all of the last year went by, but here we are on Halloween again. To give you an idea of how unwell I am, my one goal since I don't know, it was like mid-September when my ex-mother-in-law got me some Halloween fabric, was to make my children trick-or-treating bags. And that hasn't happened yet. I have a full sewing room. Making bags is easy. They don't have zippers or anything like that in them, so they're relatively easy. But in the last month, I have been so sick that it hasn't happened. And so hopefully they're okay with, Halloween bags moving forward, and using them later. My son is 13 and he said, I don't even think I'm gonna go trick-or-treating, Mom. And I was like, okay, that's fine. Like, I'm not gonna tell him when to quit and when not to quit. And I just want my kids to have things from me that make them think of me and remember me. And that brings us into the conversation today. And even though I feel like I look fairly well on this video, the lighting seems to be doing nice things. My hair looks nice and shiny and clean. Chronic illness is actually kind of funny because this is the first time I have seen my natural hair color since I was 19. Anyway, outside of all of that, I'm actually really, really sick. And I think the only reason I'm able to even sit here and present myself in this manner is completely related to the fact that I have my oxygen high enough that it's hiding how blue I would be otherwise. And then the light is coming up but otherwise, the vast majority of the time when I personally look in the mirror myself, I look very, very sick. And that brings me to the topic of conversation. I've sort of started this channel and I've talked about being chronically ill, but what point does chronic illness turn into actively dying? And at what point do we say, hey, I am actively dying? It's really easy in some situations where you have a diagnosis that goes along with it and says, this person is actively dying. However, in my situation, I think things are getting just a little bit more complex. And I'm a registered nurse, and so I've watched this process happen so many times, and I've watched it happen really, really quickly. But I've also I've watched it happen over a long period of time, 2, 3, 4 years, where the person just, things just aren't adding up and they get sicker and sicker and sicker, and their ability to do things shuts down and it gets severely limited. I have a dog hair in my mouth. Thank you to the doggos over there who are probably going to try to interrupt this video yet again. Anyway, I have to take this thing off, otherwise it's going to try to interrupt the conversation yet again. Anyway, the long and the short is approximately, I want to say about 3 months ago, things started to feel different inside of my body. Instead of them being relatively stable in their deterioration, the deterioration seemed to accelerate. I think it was about 3 months ago, I said to my husband, after thinking on it for quite a while, I think I might be actively dying. Like, I don't think that if I continue down this path that I'm on, that I would be here 5 years from now if we couldn't figure out what it was that was killing me and intervene. The other thing I said was I've also been thinking quite a lot about it, and I actually think I'm quite a high risk for just straight up sudden death. And I mean, we've probably all had those conversations, or at least I hope we've all had those conversations when we have children that, you know, we need to talk about death and dying. We need to take the stigma away from it, and we need to prepare for it because none of us are guaranteed tomorrow. And so it's one of those conversations we have to have. But I finally pulled off that like Band-Aid to, you know, the person who knows me the best and is watching me and is also just as educated as I am. I mean, his vast majority of his career was spent in Emerge, and I worked, you know, in a retirement home. And so, you know, like if the residents weren't with me, they were with him, you know, like if it couldn't be treated by a physician through the facility where I was looking at all the labs coming in and deciding, you know, like what is the treatment plan for this person? Do we need to get the doctor involved? Who would work with the person. But basically it was my responsibility to assess these people and find out who needed to speak to the physician on the floor, because, you know, out of 52 people, he's obviously not going to be able to see them. So this is quite common for me to assess somebody for their risk of illness. And it's also common for me to have to do that assessment without the person being verbal, because at least half the people, half the unit was a dementia unit, but there were also people who were on the side of just long-term care that weren't part of the dementia unit, but also couldn't verbalize. They just weren't either, you know, there wasn't spots in the dementia side, they were waiting for a bed in the dementia side, or whatever it might be, where they weren't a flight risk. They didn't need to be in a locked unit. So there was a really good chunk of people who needed to be assessed without being verbal. And I kind of feel like that's what my body is doing right now. I'm able to assess my body based on what it's presenting with symptoms, without it telling us what the actual diagnosis is. Yes, I have many diagnoses, right? Like, and there's many symptoms that go along with being that sick or having the type of diagnoses that I do have. So you kind of have to like wade through the symptoms of what is actually fatal and what is not fatal, and what are the signs and symptoms you might want to look for if you are fatal. And it was a little bit jarring to me that my husband responded with, "I agree." I think it was sort of a good way to enter the communication on the subject, because I don't think he was ever going to come to me and say, "Andrea, I think that you might actually be dying." But here's the kicker, you know, most people would want to know. It's not something that is pleasant to know, but you would want to know if, and most of us like to have an idea of that timeline. Is this going to be a tomorrow thing? You know, I was just told this weekend about somebody who was found to have pancreatic cancer, and, you know, the doctors thought that they would be gone in like 2 to 3 months, and they were gone in 2 weeks. So it's not unheard of for it to be a situation where, you know, something happens very, very suddenly. And, you know, maybe looking back, maybe they did have some symptoms, but they didn't recognize them, or some things just simply don't come with symptoms. And, you know, or the symptoms are so subtle. But one thing that I'm aware of is that the gastrointestinal system tends to shut down first. And outside of the fact that my heart rate is kind of funky from having POTS, the postural orthostatic tachycardia syndrome, outside of needing oxygen to help my body and its muscles like thrive and live, outside of that, which I wouldn't say are, you know, any reasons to put me in a category of either sudden death or you know, slow, prolonged death. But my overall health decline, the picture to me says it. At this point, my bowels are no longer moving. They simply do not move. I have found that after I take medication to help me fall asleep, there is a window of time where I'm not sure if it's partly the medication like side effects that it allows me to Ruby, thank you. Sorry, a little puppy was about to eat a hole in my oxygen tubing, which would make this needing to be made all over again. And she's sniffing the oxygen tubing again to she thinks, maybe I shall eat the oxygen tubing on you, mother. So anyway, my bowels have completely shut down. And I mean from top to bottom. So that pill that I was talking about, I think it has a little bit of an effect of sort of like the munchies. Like I've noticed that it'll make me feel hungry, but because it also makes me very tired, I can seem to sneak in like a small salad at that time. So if my husband goes downstairs, because again, this is the end of the day, I can't do the stairs again. If my husband goes down, I can sneak in like some avocado carrot mixed in with some like little, you know, of those crunchy little onion things, and, you know, some vinaigrette, and I can sneak that in. And then the medication puts me to sleep. That is not enough to live. I've been having issues with eating for months and months and months and months now. Everything makes me nauseated, right? Well, nausea, it goes with everything. There's like a side effect of nausea, a side effect of fatigue, a side effect of like all of these types of side effects go with all other conditions. The issue is that my stomach has stopped moving. So peristalsis, which normally like brings the food through your bowel system, has completely stopped. And again, it can slow down when you're on narcotic medications like I am. I take Percocet, the full like max dose of 8 tabs a day, because I am a chronic pain sufferer, and it isn't exactly what I would want, but it's the reality that I live. So, I mean, that's been stable now for at least 2 years. I've been managing that with, what's it called? It's PEG, polyethylene glycate or glycol or something like that. But I've been managing that as I would anyone else who was on any kind of narcotic treatment. And my bowels were still moving. PEG has completely stopped working. And so what happens is I actually am completely unable to pass gas anymore. I said to my husband, it must have been about a month ago that I could feel the pressure there to pass the gas, but I could not force it out. And that's abnormal. So like, I don't know if the muscles are becoming so weak in that area. And again, in the back of my head, I haven't been tested for mast cell activation syndrome. There's a lot of things that, you know, other conditions that are terminal that basically take away your strength and your musculature one bit at a time. And that seems to be what's happening here, but we don't know what it is. Although my blood lab values are all kind of wonky, and they say half truths of everything, but the half truths of everything that they say is life-threatening conditions. You know, like putting on 7 pounds in 2 days would be indicative of congestive heart failure. I've now been tested twice in the last 2 weeks for congestive heart failure, and that's not what it is. But obviously, since my bowels aren't moving, and the only thing that I can do is like, I'll have a cup of coffee in the morning, and then I have Ensure with a higher protein, and then I attempt, like I said, after I take that nighttime pill, to get in at least a small meal. A month ago, I could eat a Costco hot dog. Would I pay for it with absolute terrible nausea? Sure, I would, but I could eat it. Now my body is just saying no, and it's losing its hunger cues. And, you know, I had done the CT scan not too long ago, and they gave me 3 doses of lactulose within that one treatment, and that forcefully emptied everything that was inside of me in a very unpleasant manner. And I had done an enema prior to that, worried that they wouldn't be able to see anything because it felt like my bowels were stopping. And so I think like the entire GI tract has basically all but stopped. And gastroparesis, again, goes along with a lot of conditions, but it also goes along with this picture of, you know, my body shutting down one organ system at a time. And the overall picture is that, you know, a month ago, I could maybe average once a week to sit down in my sewing room and, you know, pop something out. I made this shirt a couple months back. You know, like I've made things for my kids, and I was gonna make the Halloween trick-or-treating bags and all of those sorts of things. But now I'm like, my limit, my window, my limit is shrinking dramatically. I'm puffing up like a little balloon. I went to the hospital on Saturday morning. Ruby, please don't. I went to the hospital on Saturday morning because I woke up in like 13 out of 10 pain. And my husband jokes that I'm not allowed to arbitrarily change the pain scale, and I know this. And I said, well, that can be your assumption of how things go. But I can tell you that I personally have lived through a lot of pain in my life, and there was nothing quite like that pain. It was so severe. I was trying my absolute best not to scream and scare my children, and there was absolutely no place that I could put that pain. And so in a few videos prior, I had mentioned that I fully anticipated that there would be like neuroendocrine tumors found on my pancreas. My ionized calcium is low, sort of everything, like, but the phosphorus, which is like a sort of a system that goes like this: if ionized calcium is high, your phosphorus is low, and sort of vice versa. And there's not many situations in which those two units don't work together, but mine aren't working together because my phosphorus is just fine, for example, but my ionized calcium is low. And so, you know, like Addison's disease, or is it syndrome or disease, would be one of those things. And the one thing that made me go to the hospital on Saturday was that my period stopped this last month. Well, if you'd followed the channel before, you would know that I hemorrhage every single month. And I've been approved for a hysterectomy. But then that doctor started saying, well, I can't do a hysterectomy on you. I'm just scared that I'm not going to be able to get you off of a ventilator if I put you on one. I'm not entirely sure how true that proponent is, because I've now been released from the lung specialist, and we very much believe that this isn't you know, a lung condition. This is a heart condition that's causing me to need the oxygen, so I don't need the lung specialist anymore. So let's just ask one more physician, right? Because I'm seeing literally everybody in my town, it seems, at this point. But then a physician who follows me very, very closely, and I trust more than almost anyone else, has denied me for the ketamine treatments that I was having and have had and had great success with. Last week, he phoned me and said, I just can't, Andrea. But I just can't. And I don't know if his, you know, spider senses are going off, or if it's something he's seeing in the labs. I know that he says, like, based on knowing you, that your kidney function has decreased fairly substantially in the last year, because I was asking him if he was seeing the same trend as well, and he said, like, no, if I just looked at your labs, no, but knowing the situation that you're going through, and like that you're also losing so much muscle tone along with all of this, then I would absolutely say yes. And then I told him my concerns. I told him my concerns, that I was at higher risk of sudden death, and that I thought that unless we found what it was that was killing me, that I am actively dying. And there was no disagreement on his end. So now my husband believes that I am actively dying. I believe I'm actively dying. And now a physician I respect more than just about any other physician I have ever met. In fact, I would say probably, I mean, there's lots of great physicians out there, but in my circle of physicians, I trust him exclusively. And, you know, I've taken this medication, for example, before the ketamine. I've had really great results with it. A psychiatrist approved me to have it. My insurance paid for it. My psychologist is on board with me taking it. I'm at the very top of the list to take it because, of course, the program changed in Canada. And a couple days before I'm set to start taking it, he phones me and he says, I just can't. And I think I was so shocked in that moment that I didn't build the questions until after, because here I am having this conversation with this physician that I respect completely, and he's saying, I can't give you ketamine right now, Andrea. I can't. It's not safe right now. That says something. It says something when it's a drug that you've taken, you've reacted well to it, and they're saying no. It says something when you've been approved 3 times prior to have the hysterectomy, and when you go and you say, I'd like the hysterectomy now because I'm hemorrhaging every month, that they say they're too scared to put you on a ventilator. Yeah, I get that he's scared he's going to break my pelvis or hit my bladder and cause me troubles in that area as well. But this last month, I don't have a period anymore. It stopped too. And while I don't want to look a gift horse in the mouth, because I hemorrhage every single month to the point where I just look like a walking zombie, I don't know which is more alarming. So the answer is yes. I actively think I'm dying. The one caveat that I will say, that both my husband and I believe fully, is that if we can find it, there's a chance we could stop it. there is a chance that it is reversible, slow downable. Is that a word? We could do something. But right now, everyone is getting scared to touch me. I am growing allergies left, right, and center. My period has stopped, which is just as alarming as it hemorrhaging every single month. Probably more alarming, I think. And I don't really know what to say other than that. Sometimes there's also just a feeling. The physician at the ER basically said it takes one light bulb. And he's right. I've seen it happen before. It takes one light bulb to fix the situation. But until that light bulb goes off by someone, or we find something, I can't say that my idea is something that most physicians wouldn't perhaps agree with. A lot of them aren't going to say it. I'm just thankful that I have a physician who is able to speak with me candidly, because when you're vulnerable enough to say, I believe I am actively dying, and your doctor is too scared to tell you his honest truth, that doesn't do you any good. It just makes you feel like you're crazy. Like, it's kind of like gaslighting, especially if they're sitting behind the scenes thinking it as well. I would consider that to be gaslighting. And he's doing everything he can. I have multiple doctors doing everything that they can. I'm pretty stumped at this point as to where to move forward next. My physiotherapist comes in twice a week and she helps me. She phoned me. That's one of the reasons that I had to stop the other video to start again. She phoned me and she gets reports like that anyone she's working with was in the hospital, and it was the same with home care. So like anytime I go to the hospital, not only does home care get a record of it, so perhaps I'll hear from my home care lady today, but so does she. And so she wanted to phone and see if I was even at home or if I'd been admitted to the hospital. And we decided that she was going to come today, even though my energy is so low. I woke up at 2 a.m. today and haven't been back to sleep. Yesterday I woke up at 4 a.m. and didn't go back to sleep. Like, my sleep is being interrupted on account of nausea, severe debilitating pain. But we decided that we were going to keep going. That passive range of movement, even in the bed, would be better than nothing, because we can't afford for my muscles to shut down even more and play even more of a role in my gastroparesis or, the shutdown of my bowels or whatever it is. I have to continue to try to fight these things. And so it's like, well, come help me make my brain remember how to properly do these things in bed, and help me, because I'm so weak at this point that the strength that I even had last month to keep my form proper on some of these things, I need someone to stand there and walk me through it. And the only reason that you and I are able to sit here and have this conversation, even though you're not partaking, but I'm talking obviously one way, is because I am increasing the oxygenation from my machine, and you might be able to hear it in the background, kind of like puffing or whatever, just so that I don't fall into respiratory distress. So that's what I have to say for today. This is becoming a very long video, as they all seem to be. Maybe you're falling in the same category. Maybe you feel the exact same way. I'm making an educated guess. Anthony's making an educated guess, and so is my physician, based on what we've seen kind of over our years in the medical field, but I could only imagine how a person must feel if they are chronically sick and they deteriorate as quickly as I am. And like, you can go to the emergency, but the emergency can't help you, and the medical system is under such distress right now that an admission can't be made without a diagnosis. So the only way that I would really be able to be admitted is under a failure to thrive diagnosis, and there's entire possibility that that is going to be the next diagnosis that I receive, but I'm gonna continue to fight and see if I can't stay home because it's much more comfortable, and get, you know, some more help coming in, and then cross my fingers that, you know, we're quick enough with our, you know, scans and everything like that, the different types of cancer scans that make things a little bit easier to see, or we may find a solution, but I don't know. That's just where it is right now. I hope you're not in the same situation. If you are, leave a comment below. If you have any questions, clarity, it's such a large topic. There's no way even in 30 minutes that I could cover the entirety of the topic. If you want me to delve more medically into why I believe some of the things I believe, I can kind of like speak a little bit more to lab values and that sort of thing. But otherwise, leave me a message. I hope you have a wonderful day, and it is my hope you will see me again here. Have a great day, guys. Bye.